Namaste, everybody. Well, I hope you're doing well. I hope you're all keeping good, and I hope you're all keeping it in that higher vibration. I hope you're keeping in that upper room, as Paul Selig's guides will call it. This life can be difficult. This life can be tough. And it's extra tough when you have CRPS, FND, and serious gastro problems with complications. I've been told that I need a surgery. How major or minor it is, I don't know until they actually do the surgery. I won't know until I come round from after the anaesthetic wears off. But I've been told I need to have a surgery. Without going into too many gory details, I've been pouring with blood when I've been going to the toilet in number 2, and I've been told that I have got, on top of everything else now, on top of the functional neurological disorder, on top of the FND, and on top of this serious stomach problems and everything else that's been going on, I've also been told now that I have a stomach problem which is to do with the lymph nodes bulging right out, and it looks like, well, I should have got the... I'll do a second video and I'll actually show you the pictures of what's wrong with my tummy. It's a physical problem. There's actual photographs. I should have got that ready, really. I do apologise. I will do a part 2 to this video. CRPS can be bloody complicated, and it is classed as a highly complex disease. You see, it's not just a pain disorder. It's not just a pain disease. Complex regional pain syndrome is a terrible name, in my opinion, because it indicates that it's just a pain disease. It's not. It affects your bowels, it affects your skin, your bones, your joints, your memory, your concentration, your mood. It affects your eyesight, your hearing, your heart. It affects all of your internal organs. You see, your nerves control everything that functions throughout your entire body, inside and out, is controlled by nerves. When you have 2 of the most serious nerve diseases that you can get, that a human being can acquire, when you have both of them back to back, FND and CRPS, it causes widespread problems on a complex level that baffles the doctors. So this caused physical abnormalities in my stomach. And this is not from the pain relief that I'm taking, and it's not from when I used to drink. It's nothing like that. I haven't drank for 1.5 years. It's nothing like that. This is not stomach ulcers. This is an abnormality caused by the disease. The name is so difficult to pronounce of this stomach disorder that I'm probably not even going to attempt it. I'm just going to show you the pictures, and it says the name on the bottom of the pictures, and I will show you this in part 2. It looks like big lumps, big white lumps, and it's lymph nodes that have just for some reason bumped right out. And now, of course, your lymph nodes are controlled by nerves. Everything is controlled by nerves. CRPS gives you a whole host of problems. This is why they class it as a highly complex disease. This is why the doctors get so confused. This is why nobody knows what to do with you, and everybody just says the same few words. It's 3 words. You're is 4 words actually. You're on your own. I've heard those 4 words, those same 4 words, spoken to me by every single doctor, every single consultant, and every single specialist, every single ambulance driver, and every single A&E doctor, including my CRPS consultant. He said, you are on your own. This is why they call it the suicide disease, for all of the above reasons. Because A, it's the most complex disease that a human being can possibly get. B, it's the most painful disease that a human being can possibly get. By far the most painful. With FND and CRPS type 2 in the chronic stage, the pain can reach 47 to 50 out of 50 on the McGill pain score indicator. CRPS is the most painful and the most complex disease on planet Earth, with no cure, no treatment, and no pain relief that works except for high doses of IV intravenous ketamine. But you need to be on this drip for weeks and weeks and weeks, and from what I've heard, and then you need to go back every couple of weeks for a top-up infusion for however long, and it costs thousands of dollars, many thousands of dollars, and you can only get this done in America. The UK, in my country, they just don't do this treatment. They won't even give you the ketamine, the sublingual tablets that you dissolve under your tongue. They work as well. They help a lot for CRPS, but because none of the doctors know anything about CRPS in the UK, that's not an option. So you guys in America, if you've got the money to bloody do it, of course, if your insurance even covers that, which guess what, it probably won't. That's a lot of ifs. If many people in America just cannot get any treatment because insurance companies just don't cover CRPS because we don't know enough about it, and it's such a highly complex, lifelong disease that people just don't touch you. People don't even try. Like in America, they'll give you oxycodone, maybe. Here, they won't even do that. Here, they won't give you anything stronger than dihydrocodone. Dihydrocodone is prescribed for bad backs and sprained ankles and minor fractures. Dihydrocodone is a moderate painkiller. It's not even strong. That's the most that we get in the UK. That's the most that I get prescribed. Dihydrocodone and pregabalin, but the pregabalin is for sciatica. I also have 2 bulging discs in my back, really seriously bulging discs, which are trapping nerves and causing sciatica and all these other problems. So I've been thinking, when my time is up here, when it's my time to go, when it's my divine calling to leave this realm, to leave this incarnation, I'm thinking that should just be it. And I'm thinking about getting a do not resus, DNR form completed. That way there won't be any surgeries performed without my knowing. That way there won't be any electric paddles put on me, which would massively worsen the CRPS. Either or. I got told by the UK's top ankle surgeon in London, in a London private hospital, I got told, don't get any more surgeries. Any. And certainly none on your ankle. But try not to get any surgeries at all. Because he said any further nerve damage from a scalpel from a surgery could potentially make the CRPS far, far worse. And he said, you really, really do not want that. It would be disastrous. So now I'm told you need a surgery. And I've got thrombosis. I've been told I have blood clots and thrombosis. Without going too graphically into it, down below. Yeah, it's from the stomach condition. The stomach condition creates air blockages in my guts. I have to really push, and I mean really push, like a pregnant woman pushes a baby out, to get these gas air blockages to come out, and you get these like explosive pockets of gas coming out, right? And only then can you go for number 2, right? I'm on all these different medications to macrogol and Senecop to soften the stools, so it's very soft stool. It's not that I'm constipated. I haven't been constipated for a long, long, long time. It's not constipation. It's the fact that there's air blockages throughout my guts, and I have to really, really strain every single morning. This morning, I strained, and the pocket of gas came out that always comes out with an explosion, and it splattered the toilet and filled the toilet with blood. It looked like a crime scene. And that's no exaggeration. Not pretty. And the pain afterwards, can't even describe it. I don't know. It must be the closest that a man can get to childbirth. That much blood and that much tearing down below, that many blood vessels bursting, tearing, that much tearing, and that much blood coming out, and that much pain. It must be as close to a male can get to childbirth. That's all I can say. I cannot profess to know what childbirth feels like in this life, although I have had many, many lifetimes when I've been a woman. That's for another video. That's for another video. But my last few lifetimes have been as a man. My last few incarnations has been as a male. We've all been masculine and feminine. We've all been male and female. We've all incarnated many, many times as both. We had to get the full array of experiences here. I'm just wary about this time. So I'm thinking about getting a DNR form requested by the doctors. It was recommended to me, I won't mention who, but it was recommended to me by a couple of people who are close to me at the moment. They said if you get a DNR, a do not resus, then it means they cannot do any electric shock therapy to bring your heart back, which would be disastrous. Electric shocks, which stimulate all of the nerves throughout your body, of that voltage, of that ampage, that would be disastrous. I once tried this very low voltage device. I've tried two very low voltage devices, wireless, and they just emit a very faint pulse of electricity. And if you even knew how much worse my CRPS became after that, you'd be shocked. I've got before and after pictures on my phone, and it is absolutely shocking. So I'm thinking about getting this DNR form. Do not resus, and do not, in an emergency, do not treat me. Because then if I'm knocked out, if I'm out for the count, how can I say you can't do this, you can't do that, you'll make the CRPS far, far worse. I cannot afford the CRPS to be any worse than it already is. It's already at maximum capacity. So that's what I'm thinking about doing. very strongly thinking about doing it, and I've been advised to do that by a couple of people. So that's what I'm thinking about doing. I think it's probably a very good idea. And then whenever my natural death is, whenever my time is to naturally transition out of here, that's just my time. You know, no artificially keeping me alive, no sticking blades in me and paddles on me, which would make the CRPS far, far worse. I'm already having to go for this one surgery, which I don't even want to think about the outcome. But thrombosis, blood clots, you can't mess about with that. You can't mess about with blood clots and thrombosis and blood pouring out of you like that when you go to the toilet on a morning. So you have to do something about that. You can't just leave it like that. Very difficult situation. I don't want to go for this surgery because of the risk. But I'm caught between a rock and a hard place. Some difficult decisions ahead. If I don't, I could be in big, big trouble. If I don't go for the surgery, and if I do go for the surgery, I could be in big, big trouble. Like I said, I'm caught between a rock and a hard place. And I'm gonna have to do something though, because I can't stay the way that I am. Probably gonna have to go for the surgery and risk it. Okay, this video is running on. I shall leave it here, and there's gonna be a part 2, and I'll show you pictures from the pill cam that I had, I'll show you the camera. I've kept the camera that went down all the way through, and I'll show you the results and the photographs from the imagery from the pill cam SP3. Okay, that's to come in part 2. Okay, love and light to all of you as always. Namaste.